Okay, I have a 42-year-old mother of 3 who has worsening depression over the last 6 months. She has been on sertraline 200 milligrams for about 2 months, and she has not found very much symptom relief from her depression. She denies hypermania or being manic at all. She does endorse some passive suicidal ideation without intent or plan. She has poor concentration. She's been missing work. She sleeps a lot. She has guilt. She feels like her family would be better off without her. She does have some prior alcohol use. However, she is not using anymore, and she has been sober for a while. She's not concerned about that piece. When looking at all of her symptoms, there are a couple of different differential diagnoses we could consider. Noting that there is no mania, I would rule out bipolar 1 or 2, rather. Well, bipolar 2 because there is no mania. It could be some sort of situational or persistent depression disorder. However, due to the length of it being more than 6 months and the fact that it's a recurrence from her prior episode of postpartum depression 10 years ago. 10 years ago, she had postpartum depression with some hallucinations, or she would hear things that others didn't hear. She denies this now and says this time she's not hearing anything. And she was successfully treated using Prozac and was weaned off of it and had not had a recurrence until recently. So depending on what her goals of care are will affect our decision. So she definitely does need a medication adjustment today, especially with how depressed she is. She has a PHQ-9 of 20, which indicates severe depression. I want to closely monitor her just because of the suicidal ideation. And I also want to make sure that I give her resources and get her in with some sort of therapist, psychotherapy, CBT, trauma-informed therapy. She does have some past history of sexual and physical violence against her, as well as her mother had died by suicide when she was a young girl. And so I think definitely trying to get to the bottom of some of this stuff will be helpful with her mental health moving forward. In the interim, before she is able to get into the therapist, we need to adjust her medications. We can go about it a couple of ways. One would be because Prozac had worked well for her before, we could do a cross taper and get off the sertraline and then get her back on the Prozac and see if that alleviates her symptoms more. If she does not want to do that, then we can add an adjunct, like a bupropion, 150 milligrams, to see if that kind of gives her that activating effect because it is hitting different neurotransmitters. Or we can, do a cross taper and we can try a completely different SSRI if she would like to see if that one works better. There's lots of options here. And so I think a lot of what we're going to have to do is a really thorough conversation with her about her goals of care. And then from there, we can decide what the best route is for her.